This is Late Night Help. I'm Mark Allen, Daryl Wayne, doing all the knobs and buttons here in the radio studio, and we appreciate that a lot, and keeping us on time as well. Our guest is Neal Simon, the president and co-founder of the American University of Antigua College of Medicine. During our next segment, we're going to be speaking with, get this name, Sheila Unique. She is an expert in the field of teacher efficiency, and she works with teachers to make sure that the students understand the subject matter. We'll find out more about Sheila in about 12 minutes from now. Neal, let's talk about the quality of education first that you get by going to the American University of Antigua College of Medicine.
Okay. Well, there are a couple of ways to evaluate the quality of the medical education. There are a number of schools in the Caribbean, but very few schools have the approvals that American University of Antigua has. So there are two states, New York and California, that do an evaluation of international schools that is comparable to the evaluation that's done by the Liaison Committee on Medical Education, which evaluates U.S. medical schools. Both of those states have done an evaluation of American University of Antigua College of Medicine and have approved our program. This is important for a number of reasons. One is that you cannot do residency in either of those states if the state has not approved the medical school. The second thing is there is an organization called DMHP, which is a regional accrediting body found by the U.S. Department of Education to be comparable to the LCME, the U.S. Medical Accrediting Organization. And we have been approved by that organization, which allows our students to get U.S. government loans. But more important than any of that, I think the best way to evaluate the quality of an education is by the quality of the graduates. And for example, this year, 90% of our graduates have obtained residency positions. This is in a year when some U.S. medical students have not been able to obtain residency positions.
Wow.
So that, I think, is the best indicator of the quality of education at American University.
And you just mentioned that one of your graduates is a resident at the Mayo Clinic.
Yeah, one of the nicest stories we have is we have a graduate who was an Antiguan scholarship student. I should mention that about 90% of our students are all U.S. citizens, but we also have a scholarship program for Antiguan students. So one of those students was the first international medical school graduate to obtain a residency at the Mayo Clinic in Rochester, New York. What makes that story interesting is that her husband, who I guess graduated after her, he wasn't her husband at the time, also got a residency at the Mayo Clinic. They got married and now have a child. So
that's terrific.
She thanked us not only for her education, but also for her family.
I love it.
Yes.
So you can find love as well as get a medical degree.
That's right.
We were talking about the lack of primary care physicians. We only have a few minutes left. The Veterans Administration has a lack currently of primary care physicians. I mean, a friend of mine tried to get into his primary care physician a few weeks ago, and it took 3 weeks to get in. He could have died. It's awful. Is there a similar situation with the VA?
Well, yeah, it's very interesting. The VA, which is in desperate need for more healthcare professionals, including physicians, in fact, recruits our graduates. Our graduates also participate in residency training in VA hospitals, but they will not let our third and fourth year medical students who do clinical rotations in some of the best hospitals in the United States participate in clinicals at those hospitals, even including our students who have served in the armed forces and are veterans themselves.
That's amazing. But yet they'll hire them afterwards.
They'll hire them afterwards, and one of the interesting things is one of the best ways to tell who's going to be a good resident, who may be a good practitioner, is to see how they perform as a clinical clerk. And when they are clinical clerks, that's, again, they're in the hospital, and they are performing medical services under very strict supervision. So it makes no sense with the need that they have to not allow not only our graduates from international schools to not participate in clinical clerkships.
That doesn't make sense at all. I have a feeling that takes a big chunk of your time trying to convince them to do so.
Well, we've tried, and it's not, if you ask them the reason why, they will say it's a policy that's been around for 40 years.
Well, that's ridiculous. Neal, we're going to have to do this again sometime. Neal Simon, the president and co-founder of the American University of Antigua College of Medicine, helping to provide primary care physicians to us here in the United States. Neal, thank you, and we'll talk again soon sometime.
Okay, thank you for the opportunity.
Thank you. All right, I'm Mark Allen. Coming up next, Sheila Unique. Don't go away.